Okay, picture this. You're a horse breeder, right? Everything's planned out for the season. Genetics, timing, health checks, it's all meticulous. And then, bam, something pops up. It's not thankfully life-threatening, but it just completely stops everything. Your whole breeding schedule. Derailed. Costs you time, money. It's a huge disruption. Sometimes the biggest headaches aren't the deadly diseases, but the ones that just grind operations to a halt. Welcome to the deep dive. Today, we're tackling exactly that kind of problem. We're going deep on equine coital exanthema, ECE. Some people call it genital horsepox. Now, don't let the name put you off. It sounds a bit grim, maybe. But as we unpack it, you'll see ECE is actually a fascinating look at how, well, a relatively minor virus can cause major waves in the breeding world. And it really highlights why things like biosecurity are just so critical, especially when you're dealing with threats you might not even see.
That's exactly right. This is why this conversation matters to you. Whether you're deep in the breeding business, maybe a vet student, or honestly just interested in animal health, ECE.
Yeah, it's generally benign long-term for the horse's health, but boy, does it throw a wrench in the works for breeders temporarily. So our mission today, let's extract the must-know info. What exactly is ECE? How does it actually spread? What should you be looking for? How do vets pin it down definitively? And crucially, how do you manage it and even better prevent it to protect those really vital breeding operations?
Right. We've waded through quite a stack of research focused specifically on ECE for this. So let's get started. Let's unpack this virus. Okay, so first things first. What is ECE? What's the culprit here? Our sources point squarely at Equine Herpesvirus-3, EHV3. Now, this is really important to get straight. It is an alpha herpes virus, but it acts very differently from, say, EHV1 or EHV4. Those are the ones you hear about causing, nasty respiratory issues, neurological problems, even causing mares to lose foals. EHV3, it tends to stick to the reproductive system. And a key thing here is that it's primarily a venereal disease, which means basically it spreads almost entirely during natural mating, direct sexual contact. And here's something interesting. While it's super contagious in that context, it usually stays pretty localized, right there in the reproductive tract. And critically, it doesn't seem to directly mess with fertility in the long run, which is, a huge relief for breeders. But, as we'll definitely get into, it still creates some pretty big management hurdles.
Okay, so direct sexual contact, that's the main highway for this virus. Makes sense. But you know how viruses are? Sneaky. Are there less obvious ways EHV3 can get around? Things that might catch a breeder off guard?
Oh, definitely. And this is where it gets really quite interesting and, frankly, a bit challenging for prevention. Beyond that direct mating contact, there's this significant risk of indirect spread, often called iatrogenic transmission.
Iatrogenic, so like through procedures.
Exactly. Contaminated instruments, maybe equipment, even just hands during vet checks or breeding procedures. Think about shared gloves, ultrasound probes that weren't perfectly cleaned, AI equipment like the artificial vagina sleeves. If they aren't meticulously disinfected between each and every horse, boom, you can spread it.
Wow, okay. That's huge.
It is. And then there are even reports, though maybe less common, of non-coital spread, like nasogenital contact.
You mean like nuzzling or during teasing?
Potentially, yes. And there's also a theoretical risk with semen, both fresh and frozen. If the stallion has active lesions when semen is collected, or if the collection equipment itself gets contaminated, the virus could potentially be present in the semen sample used for AI.
So it's not just natural cover we need to worry about.
Precisely. And this leads to probably the biggest management headache, the silent carrier state. Infected horses can carry this virus for life. And the really tricky part, they might shed the virus, become infectious again without showing any signs. We call this asymptomatic or subclinical shedding, especially in mares. This contributes to those sporadic outbreaks you see popping up around the world. It really begs the question, how on earth do you manage a disease effectively when your carriers might look perfectly healthy? It complicates prevention immensely.
Yeah, that's a massive challenge. Okay, so managing silent carriers is tough. Let's switch to what you can see. What are the visible signs? How quickly do things show up after exposure?
Right, so the incubation period is usually pretty quick, typically somewhere between, say, 4 to 10 days after the horse is exposed. And the lesions themselves, thankfully, they follow a fairly characteristic pattern, a sequence that really helps with spotting it.
Okay, let's break that down. What about stallions first? What would you notice? For stallions, the sources say you'll usually see these, initially small blisters, vesicles, popping up on the penis, usually within 5 to 9 days, sometimes later on the prepuce too. These quickly turn into pustules, then they rupture. and leave behind these open, sort of crater-like ulcers. They can get up to maybe half an inch, 1.5 centimeters across. Then they heal up over a few weeks, but often leave these distinct white spots, depigmented scars. Now, here's the really critical bit for breeders. Those ulcers, they can be really painful,
Extremely painful, yes.
which leads to the stallion just not wanting to breed. Reluctance or even complete refusal to get an erection or mate. That pain is a major, major issue. Stops breeding dead in its tracks. Sometimes stallions might seem a bit off, too dull, maybe not eating, slight fever. Not always, but it can happen. And if somehow breeding does happen when those ulcers are raw, you could even see blood in the ejaculate. Hemorrhage.
Right. Now, for mares, the picture can be a bit different, sometimes more subtle, especially at first. You might initially see these tiny, like 1 to 3 millimeter circular red bumps, papules. They appear on the vulva, inside the vaginal vestibule, the clitoral sinus area, and the skin around there, the perineum. Honestly, they can be easy to miss if you're not looking closely.
Okay, so they start small and red. Then what?
Well, over the next day or two, 24-48 hours, those little red bumps develop into fluid-filled blifters, the vesicles. And just like in the stallion, these ruptures, they form shallow, painful, crater-like ulcers. Sometimes they have a kind of gunky, purulent center, and occasionally several small ulcers might merge together, forming larger, raw areas.
Ouch. Sounds uncomfortable.
It definitely is. You might also see swelling, edema around the vulva and perineum, sometimes even down the inner thighs.
Yeah.
Mares usually don't get the systemic signs like fever or going off their feed that you sometimes see in stallions, but they'll show local discomfort. You might see them swishing their tail a lot, urinating frequently, maybe some discharge. Discomfort, especially when they pee. Or, rarely, if they happen to get lesions on their teats, it could be uncomfortable when nursing a foal.
And how long does this last in mares?
The good news is, if there are no complications, the lesions usually heal up within about 10 to 14 days. But, like the stallions, they often leave those telltale little white scars, the depigmented spots, which can hang around for a long time. And something else to note with mares, especially older brood mares, they can sometimes get recurrent episodes, particularly late in pregnancy or just after foaling. The exact link to the virus reactivating isn't always crystal clear, but it happens. And as we touched on with the carrier state, even after a mare recovers from an obvious infection, she can have these periods of asymptomatic reactivation, meaning the virus wakes up, she starts shedding it again, but she looks completely fine, no new sores, which again makes control really tricky.
Right. So the takeaway on signs seems to be self-limiting, yes, but definitely painful temporarily. And those white scars are a key clue. Plus, the silent shedding complicates everything. Okay, so that brings us to diagnosis. A vet sees these signs. What happens next? How do you actually confirm it's ECE?
Well, a lot of the time, the diagnosis really starts with those clinical signs we just talked about. The specific look of the lesions, those papules, vesicles, pustules, ulcers, and where they are on the external genitals. That's highly suggestive, especially if there's a history of recent breeding or maybe new horses coming onto the farm. It's often the first big flag.
Okay, so the signs are a strong hint. But are they foolproof? Could anything else look like ECE? Anything that might confuse the picture?
Absolutely. It's not always a slam dunk just by looking. You do need to consider other possibilities. Things like physical trauma to the area, maybe a bacterial infection setting in, certain skin reactions, contact hypersensitivities, or even though it's pretty uncommon, another viral disease called vesicular stomatitis could potentially cause somewhat similar looking sores.
Ah, okay, so differential diagnosis is important.
Exactly. Which is why, while the clinical signs point you strongly in the right direction, getting that laboratory confirmation is really essential. You need it for a definitive diagnosis. And the gold standard test, the best one we have, most sensitive, specific, accurate for detecting the actual EHV3 virus DNA, is PCR, polymerase chain reaction.
PCR, we hear about that a lot these days.
I do. And it's perfect here. You take a swab, ideally right from the edge of an active lesion, a fresh papule, vesicle, or ulcer. Send it to the lab, and the PCR test looks directly for the virus's genetic material. It tells you definitively, yes, EHV3 is present and active right now.
So that confirms it is ECE and the horse is infectious.
Precisely. There are other methods like trying to grow the virus in cell culture, but that's slower and less common now. And antibody tests, looking for the horse's immune response in blood samples. They can show past exposure if you see rising levels over time. But PCR is really preferred for diagnosing an active infection and knowing if the horse is shedding virus now. Biopsies can also show characteristic changes under the microscope, but PCR is usually the go-to.
Got it. PCR is key for confirmation. So, okay, let's say it's confirmed. You have ECE on the farm. What do? You mentioned there's no actual cure, So what does management look like?
That's right. No magic bullet cure for the virus itself. Treatment is really about supportive care, helping the horse heal and preventing spread. But the single most critical, absolutely paramount part of management is sexual rest. Full stop.
No breeding. At all.
None. Affected mares and stallions must be completely withdrawn from all breeding activity until every single lesion is fully healed. That usually takes about 2 to 3 weeks, give or take. And ideally, a vet should confirm they're fully healed before they go back to breeding. This isn't optional.
Right.
It's the cornerstone of stopping the virus from spreading further and just allows the horse's body time to heal those painful sores.
Okay, sexual rest is number one. Makes total sense. What about like day-to-day care for the horse? Hygiene, anything to help healing or stop secondary problems?
Good point. Basic hygiene is important too. Our sources recommend carefully cleaning the affected genital areas daily. Use a mild antiseptic solution, something like dilute povidone iodine or maybe chlorhexidine. Gentle cleaning.
Okay.
And sometimes topical antibiotic ointments can be helpful. Not to treat the virus, obviously, but to prevent or manage secondary bacterial infections. Those open ulcers can get contaminated maybe with bacteria like Streptococcus suepidemicus, and that can actually slow down the healing process, so antibiotics can help there.
And isolation, presumably.
Oh, absolutely. Isolating the affected horses from others, especially those involved in breeding, is fundamental biosecurity. You have to contain it.
Which brings us squarely to biosecurity. Preventing this in the first place or stopping an outbreak from spreading like wildfire.
Exactly. This is where breeding facilities need to be really, really strict. It ties back to that indirect spread we talked about. It means using brand new gloves for every single horse exam or procedure, or ensuring equipment is thoroughly disinfected between horses. We're talking ultrasound probes, AI liners, any instruments used. One horse, one set of clean gear. No exceptions.
That sounds labor-intensive but crucial.
It is. And also, meticulous cleaning and disinfection of the environment stalls, breeding stocks, the whole breeding shed area, that's vital too. Even basic breeding hygiene makes a difference. Things like washing the mare's perineal area, maybe with plain water and a bit of povidone iodine solution. And washing the stallion's penis, again, just plain water, often recommended both before and after mating. These steps can really help cut down the spread, especially from those sneaky asymptomatic carriers we mentioned.
Right, the ones that look fine but are still shedding.
Yes. And because of that iatrogenic risk spreading it via equipment, it's really best practice to use disposable instruments, if you can, when working with an affected horse, or instruments that can be easily and completely sterilized.
Okay, that's a lot on management and prevention. Let's circle back to something you mentioned earlier, which is probably top of mind for any breeder listening. Does this actually affect fertility long term? Does having ECE mean a mare or stallion won't be able to reproduce successfully down the line?
That's the million-dollar question, isn't it? And the good news, based on everything we know and what our sources say, is no. ECE itself does not appear to cause permanent infertility or issues like abortion. In terms of long-term reproductive health, it's considered pretty benign.
Okay, that's a huge relief.
It is, BUT. And this is a very big but for breeders. The major negative impact is that temporary disruption to the breeding schedule.
The downtime.
Exactly. Having your key stallion or several mares out of action for 2, 3, maybe more weeks during peak breeding season. That's not just an inconvenience. That can mean losing an entire foal crop for the year from those pairings. It can jeopardize carefully planned genetic crosses, and the financial consequences. They can be really significant. Lost stud fees, lost foal sales, extended boarding costs. It adds up fast. The economic hit is the real sting of ECE.
So the disease itself isn't the long-term threat, but the disruption it causes is.
Precisely. And remember, like other herpes viruses, EHV3 sets up shop for life. It establishes a latent infection. That means the virus hides out, inactive, and can then reactivate later, often during times of stress. We suspect this silent reactivation, or recrudescence, especially in stallions, is a major way the disease keeps circulating. It really highlights that the number of horses carrying this silently might be much higher than we realize.
Because you only notice when the sores appear.
Exactly. And adding to the challenge, the immunity a horse develops after an infection. It doesn't last very long. It's short-lived. So horses can actually get reinfected, maybe even in the same breeding season, or definitely in subsequent years.
Oh, so they're not one and done.
Unfortunately not. Which just underscores the need for ongoing vigilance and prevention. Key strategies really boil down to always doing a thorough visual check of the mares and stallions' genitalia before any breeding.
Hmm.
every single time. Implementing good quarantine procedures for any new horses coming onto the property before they mix with the breeding stock. And the absolute hard rule, never breed a horse that has any active visible lesions. Just don't do it.
What about AI? Artificial insemination, could that be a workaround?
It can be, strategically. Say you have an infected mare, but you really need to get her bred to a specific uninfected stallion. AI, using semen collected carefully from that clean stallion, can bypass the direct contact and reduce transmission risk, provided, of course, the breed registry allows AI. Or, if a stallion had lesions but is now fully healed, careful semen collection, perhaps using an open-ended artificial vagina to minimize contamination from the penis surface, and then AI could be an option to reduce risk compared to natural cover. But extreme care is needed.
Right, makes sense. Okay, let's try and wrap this up. We've covered a lot of ground on equine coital exanthema. So the key takeaways seem to be it's EHV3, a contagious venereal herpes virus, causes those painful but ultimately self-healing sores on the genitals. The big threat isn't really long-term fertility damage, but it's the major disruption to breeding schedules and the economic fallout from that. And management hinges crucially on sexual rest, really good hygiene, and super strict biosecurity protocols. That sums it up well. It's about vigilance and management. And maybe a final thought to leave you with, considering how tricky these latent infections and silent carriers are. How might future advancements in, say, rapid on-site diagnostic tests that could maybe detect shedding before lesions appear, how might those further change how we manage breeding biosecurity for diseases like ECE? Moving beyond just what we can see with the naked eye, something to think about.